Alright, so the physical agent that I want to use with Carl to help with his pain modulation is an ice pack. And I want to use an ice pack because it will increase the pain threshold by instigating local anesthesia, the gate mechanism, slowed nerve conduction, and reduction of spasms and reduction of edema. The parameters that I'm going to use for the ice pack is from a 10 to 20 degree Fahrenheit unit. And then I'm going to put the ice pack in a pillowcase, and then I'll have like a towel or some other cloth between the skin and the ice pack. And I will leave this on the patient for 15 minutes. I will be checking the skin around every 5 minutes to make sure there's been no reaction on the skin. The patient will be in a supine position with the left lower extremity propped up so that the knee is an extension. And then I will place the ice pack around the knee and get in as much surface area as I can because the pain goes all the way around. And then some precautions that I want to assess before is his cognition and communication abilities, just to make sure he can tell me how he's feeling, as well as check his blood pressure because of his hypertension. And then I want to just go ahead and assess his skin for any rashes or burns that I shouldn't be putting ice on. And do you have any questions before I begin? Okay. So Carl, I think that today you will benefit from an ice pack to help with your pain surrounding your knee. So basically what an ice pack is going to do is it's going to slow down the nerves that are carrying pain to your knee, so then you'll have like a decrease in your pain. And before we use the ice pack, I just want to make sure that you're a good candidate for it. So I have a few clarifying questions for you. Have you ever had frostbite? How is your tolerance to cold? Do you have any conditions related to cold temperature that we might have missed on the intake form? How about any skin anesthesia in the area? Or peripheral vascular disease, Raynaud's disease, over-regenerating peripheral nerve, and no other diagnosis related to cold. Good. All right, looks like we're good to go with this. And so for using the ice pack, I'm gonna have you lay on your back and I'm gonna prop your left foot up. And then I'm going to place the ice pack around your knee, and it will be on you for about 15 minutes. And during that time, you don't have to do anything. You can just relax. You should feel a cold feeling, and then it will be a little burning, and then maybe some achy, and then numb throughout that 15 minutes. And then I'll be around every 5 minutes to come and check on you, make sure you're doing good, and check on your skin to make sure we're not getting any rashes or reactions. And here is a little bell. If you get uncomfortable or the ice is just not feeling right or your knee is uncomfortable, you can just ring this bell and I'll come right over and we'll get you situated and what you need to be comfortable. And so to do this, is it okay if I pull your pants leg up to expose your knee? And then I'll also need to view and place my hands around your knee and leg just to assess the area before we begin. Is that okay? And then do you have any questions before we use the ice pack? All right, are you ready to start?